we're joined by our first guest today. He is Dr. David Donaldson, who is the Vice Chief of Beaumont Troy ER, the ER Center. Dr. Donaldson, thank you for being with us again today.
Yeah, no problem. Good morning.
Appreciate having you on. Since we've last spoke, how you been?
I'm fine. Staying healthy. Hopefully everybody else is.
Yeah, that is good to hear. We have continued to progress through the COVID-19 pandemic. We've seen a little bit of a spike in cases as of late in the state of Michigan. Dr. Caldoun yesterday had mentioned that's starting to plateau. It seems like that's back to under some control, so at least that's good news. We have not moved into phase 5 yet, out of an abundance of caution, but we're still very much involved in the COVID-19 pandemic. In terms of emergency room services, have they changed at all since we've last spoken? Have more services returned to Beaumont Troy Hospital and to Beaumont Troy's ER system that maybe weren't in place earlier on in the pandemic?
No, we're still doing our best to keep patients that have COVID or suspected COVID enter through a separate entrance, go to a separate portion of the ER. We're doing our best to do that. Luckily, we've seen the normal ER kind of cases return. There was a period of time, as I mentioned last time, that we weren't seeing the heart attacks, the strokes, the severe injuries. Patients were basically too scared to come in. So we've really been trying to get the message out that we're there with a clean, portion, non-infectious portion of the ER to care for you. So luckily, we've seen those type of patients come back and not staying at home with these serious medical problems.
Doctor, my father was recently admitted to the hospital in Ohio. One of the things that's so hard is still the limitation on visitors. What is the situation where you are?
So that has changed since we talked last. We do allow currently visitors for patients. We do limit it. We try to limit it to one visitor per patient in the emergency department. If it's a critical situation, an end-of-life situation, we make exceptions to that. Pediatrics, both parents can come back.
Dr. David Donaldson with us. He's the Vice Chief of the Beaumont Troy Emergency Room Center on the Oakland County Megacast with us. So for those that maybe still are concerned to investigate what these ailments they may be feeling that may be symptomatic of heart attack or a stroke or other conditions that need immediate emergency attention, what kind of complications can be had as a result of not getting those checked out in a timely manner?
Sure. I mean, strokes, there's a very narrow period of time that we can actually treat you and provide some benefit to you. And if you wait too long, you're out of that window. The same thing with heart attacks. Again, you have to come in quickly. The quicker you come in, the quicker we can take care of you and get that taken care of. Same thing with traumas and injuries. I mean, I've seen situations that patients were scared to come in with bad injuries and suffered, long-term consequences because it wasn't cared for timely. So I just want to reinforce that we are safe. I mean, we have a safe area for you to come. If you have any hint of infection symptoms, fever, cough, you are brought to a separate area, and we do our best to keep that separated.
Dr. Donaldson, I'm just curious, I'm sure others are too, because in the times that we're in right now, every little symptom makes you immediately think, okay, maybe this is the beginning of COVID. Maybe I'm just, or you're thinking, well, maybe I'm just psyching myself out and this is just a simple cold or something. But in just a general sense, even beyond the COVID symptoms or COVID adjacent symptoms, what should people be considering before they go to an emergency room to determine if they need to go, if they should go in an abundance of caution, or if it's better for hospital resources and for them as well to stay home?
Sure. I mean, I think to break that up into a couple different parts, if I would treat your symptoms, your non-COVID type symptoms the same you would have before this pandemic started, just keeping in mind that we do our best to keep you safe. And, if you're having chest pain, if you're having shortness of breath, if that kind of stuff, don't be afraid to come in. We'll care for you the same exact way we did before this started. And then in terms of the second part with, if you wake up with a sore throat or the sniffles, it's easy to psych yourself out. I agree. But I do think we have to take those serious because that could be early signs of symptoms of COVID. I mean, and, the same thing you might have thought before all this started, hey, it's just my allergies or I've got the sniffles. I think you really do have to have the self-awareness that, you don't want to expose other people and do your best to stay away until it defines itself.
In the past, Dr. Donaldson, it's been advised that if you are feeling some of those symptoms and you're going to go to see your primary care doctor, or you're going to go to the emergency room if those symptoms are more severe, that you should call in advance and give them a forewarning to make so that they can be prepared for someone that may potentially be COVID-19 positive. Is that something that's still being suggested today? What should people do when they are on their way to the emergency room if they're not going by calling 911 and being in an ambulance, to make sure that those on the front lines are prepared for them to come in?
Sure. I don't think it's necessary you call ahead to the ER, your own doctor. I think that's probably very helpful. We have 24/7 a greeter nurse that stands outside of the building. So as you drive up, you are actually greeted in your car. And if you have any symptoms that we're worried may be COVID, such as what we talked about with the cough and fever and those sort of things, then you're escorted through a separate entrance into a separate area. So I don't think it's, to answer your question, necessary to call ahead, but you just want to make it clear when you arrive to that nurse while you're still in your vehicle of your symptoms.
So many people have tested positive, but they've been asymptomatic. What happens if they come into the ER normal channels and then you find out later that they are positive for COVID? And is everyone tested?
Sure. So to answer that, right now, everyone is not tested because there is limitations in the testing capabilities. The tests that we use and most hospitals use is a very sensitive test. But the downside is there's not enough reagent to run that test for everybody in a hospital setting. So currently we do it by symptoms, but to answer your question, it is possible, just like it's possible to, walk into Target or Meijer and be asymptomatic and have it. So we always socially distance. We always wear a mask. The patient and the providers always wear masks. So we do our best. Just basically we treat everybody as having it, at the time that we see them, because it's easier to be overcautious and undercautious.
Dr. David Donaldson with us. He's the Vice Chief of the Beaumont Troy ER Center, with us on the Oakland County Megacast, discussing, of course, the ongoing COVID-19 pandemic, as well as emergency situations in which people should still be going to visit a doctor at the emergency room. So in the past, we've seen people have been really cautious to go to the ER, and that did cause a lot of problems early on for people that had heart attack symptoms, stroke symptoms, other major injuries that they didn't go and get treated. And we've talked about why that is dangerous and why people should not be doing that necessarily. But in terms of now versus before, are people more comfortable going back to the emergency room when they have these symptoms from what you've seen? Or are we still in a position now where we're seeing people be apprehensive to go to the hospital to get treated for these emergency situations because of COVID-19?
I do see a little bit of apprehension in talking to patients and even friends outside of the hospital, but it has really taken a 180. Like I said, at the peak of this and end of March and April, it was terrible, the amount of patients that we saw that were suffering at home and either passing away at home or coming in too late. It was unbelievable, the amount of patients that were staying home because they were afraid to come in. And again, I've seen a big change in that. It's not back to normal by any means, but it's much, much better.
As a cautious tale for those that maybe still are apprehensive and don't want to go in and get those symptoms checked out and want to tough it out at home, for those that in the past did come in after the fact and came in either too late, you mentioned some had passed away at home, but others had complications because of how long that they waited. What kind of complications could people experience if they do wait too long on heart attack, on stroke, on some of these other injuries that you and your team at the Beaumont Troy ER Center have already seen?
Sure. No, I've seen, some of them we don't see because we pronounce them at home. So we'll get a call from EMS that, a patient has died at home, and we have to give the medical direction that patient has expired. And we saw spikes, just tremendous spikes, end of March, April into May with that. And reports from families were that patients were having chest pain, or patients, were having shortness of breath, and it sounds like they were just afraid to come in. So the stats actually bore out that occurred. That's just, it's not just my opinion, that the stats has borne that out in Macomb and Oakland County. So that was, a couple months ago. That has luckily trended down. But I've seen, we talked about the big stuff like heart attacks and strokes. I've seen cases of appendicitis that patients were afraid to come in and sat with appendicitis at home, for a week or two. And by then it's perforated and you have a whole other set of problems. I've seen bad leg injuries. I've seen open injuries, so actually bones sticking out that patients were afraid to come in. I mean, it's just stuff like that I just really want to get that message that, if you're having those type of issues, it's safe to come in. We're doing a good job, like I said, separating patients best we can. And then we've got plenty of personal protection equipment. That's not an issue any longer. So the safety is definitely there at this point.
I know that you're in the ER, but how are things going in the elective surgery area? Because I know hospitals really relied on those type of surgeries for their bottom line. Is that picking up again?
It is, and it's not just a bottom line issue, but it's also a patient safety issue. I obviously work in the emergency department, so I don't have firsthand knowledge, but in speaking with colleagues, there was a lot of patients with cancer screening that was not done, with cancer surgeries that were delayed, that had long-term effects from not proper screening, not proper removal of certain cancer type issues. So luckily that stuff has ramped back up, that these patients can get that care that they need, the preventative care as well.
I know we're pretty flatlined in this disease here in Michigan right now, but as you see what's going on in some of these southern states, are you still concerned that we could see a second surge and that maybe the hospitals wouldn't be prepared for it?
I mean, it's always a concern, but I've been intimately involved with this since the beginning at Beaumont, and just the lessons learned from the first wave, with everybody, I'm sure around the country, that if there is a second wave, we will be much more prepared. In fact, I've done some conferences with FEMA and some education pieces with some hospitals in Texas that we went through a couple of months ago, and just shared all of our lessons learned with those hospitals, and in terms of things that we did and worked well. So it's been a lot of communication. Before it hit us, we were actually in communication with a physician in Italy, some people in state of Washington, again, just learning from each other, because this is ever changing of what worked and what didn't work.
Dr. David Donaldson with us. He's the vice chief of the Beaumont-Troy ER Center, with us on the Oakland County Megacast. This pandemic has taken a great toll on hospital staff, especially as they have been working longer hours. Nurses, doctors, and other staffers working longer hours have seen on the front lines the toll of this pandemic on the community. How are the workers at the hospital holding up now that we're at a point where it's kind of stagnated in the state of Michigan? We've leveled off and we've returned some semblance of normalcy to our hospitals. How are they holding up now? Are they recovering from what they've been going throughout this pandemic?
Yeah, I think so. And I think a lot of that is the fear of the unknown is no longer there. So we know how to keep safe, ourselves safe, our patients safe. Like with anything new, when this first started, everybody was scared to death. But again, with the lessons we've learned, the lessons that we've learned from other people that went through this before us, I think the anxiety of the unknown has really gone away, and we know how to deal with this and keep ourselves and our patients safe. So that's really helpful with morale and getting, like you said, back to normal, some sense of normalcy.
So my niece is a nurse as well, and healthcare workers have been put on the front line of this pandemic. How much has the support of the community meant to you and your staff and all of those in the healthcare industry?
Oh, it's meant a ton. I mean, we were very well fed in the beginning of all this, which was nice. But the support of just seeing the signs, seeing the the ribbons. You'd walk out of work and there'd be banners hung, rocks painted on the ground, thanking us, and and parades. I mean, it was very, very helpful at the times that the morale was pretty low and that uncertainty was there. So yeah, I mean, I think it was really helpful.
Dr. Donaldson, anything else for us today? Any other points that you want to make before we let you go?
No, I think we touched on everything. I just again want to reinforce that if you're having issues, we're there for you. COVID, non-COVID, the COVID numbers have definitely dropped, but we're treating, like I said earlier, everybody in our minds as having it until we prove they don't, to keep us and you safe.
Well, Dr. Donaldson, thank you very much for being with us today.
Yeah, thank you.
We appreciate it. Dr. David Donaldson, he is the Vice Chief of the Beaumont Troy ER Center, with us on the Oakland County MegaCast.